answering your questions about COVID-19 with Cone Health's COVID-19 lead physician, Dr. Brent McQuaid. This person is asking, how are they testing for the Delta variant? Does it show up in the PCR tests that have been used since the beginning of COVID?
That's a very good question. So in order to test for the Delta variant, you have to use fairly sophisticated sequencing techniques in order to identify it. At Cone Health, we are able to detect when patients have COVID using PCR and antigen tests, and then we submit samples at random to the state and to the county, and they handle our Delta variant testing for us. So when we are talking to the community about a rise in Delta variants, it's not because we've tested it ourselves, it's because our county and state partners are giving that information back. And right now, greater than 90% of our isolates are all positive for Delta.
So most of us, if we got sick or something like that and we tested positive, we wouldn't know right then and there that it was the Delta variant. It would happen later, and would we ever even really know?
It's very unlikely that you'd ever get a final test that would say you had Delta. However, what I'm telling everyone who comes into the hospital right now is you have Delta, because it's so prevalent in the community. We've seen such a fast rise that we know that the vast majority of what we're dealing with is Delta.
This person says, how long after being sick can one be tested to determine if they had COVID-19?
Well, so it depends on the nature of the test. If you're sick within the last day, you can certainly go in and get a nose swab test, and you get an answer in some cases within an hour, in some cases within 24 hours. If, however, the nature of the question is, well, I was sick a few weeks ago, now I'd like to get a blood test to know if I had COVID or not. Generally, the answer there would be in the 4 to 6 week range would be the safest bet for when you'd want to get serology testing or the blood test to try to figure out if that cold you had a month ago was COVID.
Gotcha. And would that then show your antibodies? You had antibodies for that?
Yep. When we do the blood test, that's what we're looking for. That's where we look for the antibodies to COVID.
Okay. And so this question kind of follows up on that. This particular person has severe autoimmune issues, and she had COVID and also had her vaccine, but there were no detectable antibodies. Why is that? And then what should she be doing?
Right. Yeah, that's a difficult situation. And you know, it's hard to know, not knowing all the details of that individual's care. If you have a lot of autoimmune problems, it's possible that maybe that person is also taking medicines that are directed to those autoimmune conditions, and those will affect your immune system and your response to vaccinations. And so, you know, it's possible that because this individual has an abnormal immune system, they don't mount a normal response. We do know from studies that have been done that patients can have undetectable antibody levels, but yet still have, after vaccination, and still have immunity to COVID-19. That being said, for this particular individual, I would recommend extra precautions. So paying attention to social distancing, wearing a mask, you know, things along those lines. Sounds like she's got some baseline medical problems, and without a detectable antibody, she should be extra careful.
This person says, since variants of COVID-19 are popping up, are booster shots available now? If not, when will they be?
I wish they were. We believe they will likely come online, but we're not given license to do that really until the state and federal government tells us that we're allowed to. So I do think that booster shots will be helpful particularly for our most vulnerable patients, but right now we're not offering it because it's not a labeled indication.
All right, this person passed along something that they saw on Facebook today, which said that the hospitals are telling people that the COVID-19 Delta variant is being spread rapidly through gasoline pumps and asking everyone to use gloves or use paper towels when refueling. Can you speak to that?
That's not any information that I've heard, and I'm on almost every meeting about COVID and Cone Health, and so that's not something that we're passing along. Although certainly when you go to a gas station or any event or activity that you do that involves other people around, it's still a really good idea to practice social distancing and wash your hands just like you would under any other circumstances.
So maybe that also we talk about how is COVID transferred from one person to another?
Right. Yeah. Good question. So really, it's close contact. It's being around other people. It's, being within that 6 feet area of where another person who has it, maybe they have symptoms, maybe they don't know have symptoms, is just doing regular day-to-day things. They're just breathing. They're maybe touching their face and then touching the same surface that you might touch, or maybe they're touching their face and they're shaking your hands. It's close contact with other individuals, hands down, is what spreads the virus.
This person's asking, if a member of my family tested positive, is it safe for me to go to work?
Right now, so we would just ask that person to monitor for symptoms. It's not recommended that every individual who has a close contact be tested. We just have individuals that, for example, at Cone Health, if we have team members who come in who have family members who've been sick, we ask them to be extra careful about filling out their daily screening questionnaire for whether or not they have symptoms. And certainly if they do, they be tested right away.